Thank you for tuning in to our LTISD Mental Health Parent Series. In this session, we will talk about the basics of anxiety and depression and how best to help your child deal with these issues. First, I'd like to start by introducing our team of social workers who will be providing the content throughout this series. We have 5 social workers in Lake Travis ISD who are all licensed mental health professionals with many years of experience in education, training, and working with youth and families. First is Daniela McFarland, who will be speaking to you tonight about anxiety. She is the social worker for our Hudson Bend Middle School feeder pattern, including Lake Travis Elementary and Lakeway Elementary. We also have Tracy Barney, who serves our BCMS feeder pattern, including BCE and LPE. Colette Sween, who serves as the social worker for the LTMS feeder pattern, including Rough Hollow, West Cypress Hills, and Serene Hills Elementary. Lacey Brinker and Rachel Maycomer are both our social workers at our high school. Rachel will be speaking to us tonight about depression. And I am Jennifer Lyon. I'm the Director of Health and Social Emotional Learning. If at any time throughout this school year your child needs mental health support at school, please reach out to one of the social workers on the previous slides or any of the school counselors you see listed here. I'm now going to turn it over to Daniela, who's going to get us started talking about anxiety.
Hi, I'm Daniela McFarland, and as Jennifer was saying, I'm the social worker for the Hudson Bend feeder pattern, and I will be talking about the anxiety portion today. So some of the objectives and goals that I'll be talking about is I want to give you guys a basic understanding of anxiety and what that looks like in children and teens, which can be very different from what we would expect to see in adults. I wanted to talk about some treatment options for anxiety that you guys can do at home, at school, or in the community. And I also wanted to give you guys as parents some ideas on how you can support your anxious child at home. So this is a very clinical definition of anxiety. That comes from the DSM-5, which is what mental health professionals use to diagnose mental health conditions. But essentially, anxiety disorders include excessive fear and anxiety or behavioral disturbances. There are several different types of anxiety that I listed out here, but for the sake of time, we'll be talking about generalized anxiety disorder with or without panic attacks. That is the most prevalent anxiety disorder among kids and teens. So here are some signs and symptoms of anxiety. Per the DSM-5, again, this is very clinical language, but to qualify for an anxiety diagnosis, you would have the following symptoms for more days than not for at least 6 months. So specifically in children, what you would expect to see are a lot of physical symptoms, so sweating, nausea, IBS or stomach type issues. Headaches frequently accompany anxiety, restlessness, fatigue, sleep disturbances, difficulty concentrating, irritability can also be an anxiety symptom. Anxiety in children centers more around their school or their sporting or extracurricular performance. Children and teens face a lot of pressure every day. And for a child to be diagnosed with anxiety, what you would see is these symptoms cause some sort of impairment in their functioning. So whether that's a loss of friends, they're unable to go to classes, they're unable to compete in sports or extracurricular activities, they're losing sleep and their grades are suffering, they're having panic attacks, something along those lines that is so severe it's really interfering with their daily lives. So what can parents do? I wanted to talk a lot about being aware of your own symptoms because I think it's really important. I think it's important that we as parents learn how to tolerate our own distress because children look to us for an example, and we as adults really have to model healthy coping skills. Like I said, children are like sponges and they soak up the feelings of those around them. So if you're experiencing anxiety, it's likely that your child will pick up on those feelings and imitate them. When you can regulate your own feelings, you're better able to help them regulate their feelings as well. Empathy can go a long way, validating your child's feelings, even if you don't understand them, even if you don't suffer from anxiety. Kids are not being attention seeking when they're anxious. Anxiety can feel very scary and very real to kids. Emphasizing confidence in your child. So reminding them of times they've coped well in the past. For example, saying something like, I know it's scary and I know you can do hard things. Talking about self-care and modeling self-care. So how do you deal with your own anxious feelings and your stress? Do you have healthy coping skills? You are their greatest teacher and example. I also think it's really good to start with your pediatrician. So letting your pediatrician know that you have some concerns if you feel like their anxiety is starting to impair their life. Pediatricians can screen them and they can help you come up with a treatment plan. I think it's also great to reach out to the school counselor. They can check in with your kiddo at school, give you their perspective on how they're doing at school, and they can make referrals to school social workers, and they can provide resources to outside agencies like community therapists. So, like I said, there's therapists out in the community that can provide ongoing treatment for anxiety. And parents can teach mindfulness and grounding techniques at home. And I will go over those things in the next few slides, but essentially those are different techniques to help kids in the moment, help them calm their nervous system down. And self-soothe kits are another great tool that you can use for younger elementary age kids in the moment. And I will also talk about that in one of the next few slides. So treatment with a therapist would likely involve CBT, which is cognitive behavioral therapy. This is a very effective form of therapy for anxiety. The social workers at the school can help bridge the time until kids get to their outpatient provider. We can also do basic CBT at school, but the school social workers don't do intensive mental health treatment or intense trauma work just due to the environment of them being at school. It wouldn't be appropriate. More intense therapy really needs to happen with an outside therapist, and the counselors and the social workers are very happy to send those resources out if you ever need them. Sometimes the pediatrician or a psychiatrist might recommend medications to help relieve some of the symptoms so they can start to function again. So this is an example of a self-soothe kit, which is something you can do at home that we do a lot with our kids here at the school. The kit will really be geared to your child's specific interests and however old they are. So these are some examples of things you could put in there. Calm down cards or something you can find online and put in the box. Bubbles, essentially different sensory things. So fidget toys, weighted blankets, something they can chew, Play-Doh, headphones for music or podcasts, a notebook for art or writing, anything that really can help engage their five senses. So something that kind of tricks their brain into thinking of something else can help regulate them and calm their nervous system down. Here are some examples of different breathing exercises that you can do at home with your kiddo. Cookie breathing is one that I really like for elementary age kids, and this is something you could find online and even print out and have at home to use, and I will model that here in a second. Square breathing is another great technique to use, which is just essentially what it looks like on the diagram. So inhaling for several seconds, holding it for several seconds, then exhaling for several seconds and pausing. And belly breathing is where you put your hand on your belly. You ask your kiddo to put their hand on their belly, and you inhale through your nose and feel how your belly goes out, and then you exhale and feel how your belly goes in. So for the cookie breathing, what you would do is you would have your kiddo pretend that they have a cookie in their hand that just came out of the oven, and they would breathe in slowly through their nose because they're trying to smell the cookie, and then exhale through their mouth because they're trying to cool the cookie off. And in this example, you can cut out the cookies and place them on the plate, and a lot of times by the time they're done doing this, they end up feeling a lot better. So like I was talking about before, a really effective grounding technique is something that can use their five senses. So you can do this no matter where you are. At school, I've asked my kiddos to try and do this before, at home. But what you would do is you would ask them for five things they can see around them, and then pause and ask for four things they can feel or touch, three things they can hear, two things they can smell, and one thing they can taste. And it's a great way to have them start to regulate themselves and kind of reset. And mindfulness walk is another, I think, effective way of using that five senses technique. So if you're able to, you can take your child on a walk. It's helpful if you can do that without any auditory distractions so they can be really engaged and mindful. But you can ask them those same five questions about what do you see, what do you hear, how does the sun feel on your skin. There's been a lot of research regarding the effect of nature on the nervous system. So even if you don't have time to walk, sometimes just being outside in nature can be enough to reset their nervous system. And this is another grounding exercise called TIP, which stands for temperature, intense exercise, paced breathing, and progressive muscle relaxation. So for temperature, something like submerging their face in ice water for as long as is tolerable, tearing frozen rags, squeezing ice cubes in their hands. For intense exercise, any kind of short bout of exercise, like 10 to 15 minutes of whatever their preferred exercise is, like jumping jacks, stairs, running in place, any of that can be helpful. Paced breathing, which is like the breathing techniques that I talked about earlier. So slowing the pace of their breathing way down and breathing in for a few seconds and then out for several seconds, doing that for a couple minutes. Progressive muscle relaxation is where you would tense and relax each muscle group individually. So you would start one group at a time, starting from one end of the body and working your way up or down. And you would tense each group for 5 seconds and then let go. And this is Rachel's portion, and she'll be talking about child and adolescent depression.
Hello, so my name is Rachel Maycumber, and I am one of the social workers at Lake Travis High School, like Jennifer told you earlier. And I'm going to talk to you guys a little bit about depression in adolescents and teens and children. So much like with the anxiety portion, the objectives that we'll cover in this presentation are really just there to lay a foundation for the information and to provide you as a parent with some additional insight. So we want you to walk away from this portion having a better understanding of depression diagnoses and symptoms, how depression might manifest in children and teens, what some treatment options would be for depression, and how parents can support a depressed child at home. So for the sake of time, we're going to focus on major depressive disorder. As you may or may not be aware, there are other depressive diagnoses, such as seasonal affective disorder, PMDD, which is premenstrual dysphoric disorder, and postpartum depression. And for the sake of time, we're going to just focus on the major depressive disorder, which you might hear me use MDD interchangeably. So the DSM-5, which is the diagnostic manual that we use for diagnosing mental health disorders, defines depression or major depressive disorder as a period of at least 2 weeks when a person experienced a depressed mood or loss of interest or pleasure in daily activities and had a majority of specified symptoms such as problems with sleep, eating, energy, concentration, or self-worth. So you'll see here that we have some depression statistics, and really I'm focusing on what do we know about depression and how it affects children and adolescents and teens. So we know that 3.1 million people in the US ages 12 to 17 have had at least one major depressive episode in the last year, and that suicide remains the second leading cause of death amongst 10 to 34-year-olds, which is one of the many reasons why education on signs and symptoms of depression in teens is so valuable and important. And then here we'll see some additional facts about teen depression. It's estimated that 20% of teens will experience depression before reaching adulthood. 14% of teens have suffered from depression within the last 12 months, and 15% of teens suffering with depression will eventually develop bipolar disorder. So, what might be some potential causes of depression? Something that you might notice is if they've had intensely stressful events or major life events, hormonal changes, genetics or a family history of depression, brain chemistry, and serotonin levels. Depression can be the result of many things. It can include issues such as peer pressure, academic expectations, changing bodies. All of these things can bring a lot of ups and downs for teens. Additionally, experiences like abuse, divorce, death, sports performance, all of these can support feelings of depression. So for some teens, the lows are more than just those temporary feelings, right? We all experience crises. We all experience moments in time where we feel a little bit lower than others. But those of us that do not struggle with depression are able to kind of move through those emotions, feel them, and move along. However, those feelings for people who suffer from depression are not just temporary. Genetics and family history allow for an increased risk of an MDD diagnosis. So someone with a parent or sibling that has an MDD diagnosis has a 2 to 3 times greater risk of developing depression over the course of their lifetime compared to someone with no family history. And sometimes a person's brain chemistry is just simply unbalanced, and they might have lower serotonin levels, which is where you might have the need for medication intervention through the assistance of a psychiatrist or a pediatrician. What might be some signs and symptoms that you can notice in your child? Disturbances in mood. More often than not, we're seeing irritability, someone who's quick to anger. Impaired sleep, often too much sleep. Some of them may have trouble falling asleep or staying asleep. We know that teens really need around 10 hours of sleep a night, which does seem like a lot to us. However, their brains are still growing, their bodies are still growing, so they do need that extra sleep time. And so you might think that they're sleeping too much, but maybe they're talking to you about having a hard time falling asleep. Maybe they're talking about they're getting up often at night, or maybe they're talking to you about, I'm not going to bed until 1 o'clock in the morning, but you hear them rustling around at 4:30, 5 a.m., and maybe their typical wake up time is 7 a.m. So those are some things that you might want to look out for. They might talk about feeling low energy, or you might observe their low energy, right? Maybe they're usually fairly active child, and all of a sudden you're kind of noticing, or maybe even over the course of days, weeks, or months, you notice that they're not as interested in getting up, moving around. They're just not seeming like their usual selves. You might notice a decreased self-esteem or lack of self-worth. We see this a lot, especially with teen girls. Especially when it comes to comparison, feeling less than, feeling like they're not as good as the person next to them, maybe not as good as a friend, a teammate, however that might look. And oftentimes, these signs or symptoms will go unnoticed or labeled as typical teenage angst or behavior, which is why having the foundational work surrounding depression is so valuable, so that you're able to discern between what is just typical teenage behavior and what is a deeper issue like depression. Some additional signs and symptoms might be difficulty concentrating. Maybe they talk about needing a lot of bathroom breaks in class. Maybe their teachers notice that they have increased need for breaks during class. Changes in appetite. More often than not, we're going to see excessive appetite than we are reduced appetite. Maybe they seem agitated or sort of slowed down, kind of moving through life at like a sloth's pace. Or maybe they're so bold and they have a comfort level with you as their parent to express thoughts of wanting to engage in self-harming behaviors or feeling suicidal. And I think it's important to reaffirm for you that you know your child's baseline. You know your child better than someone outside of that inner circle of the family framework, right? So your instincts as a parent exist for a reason. You know what is normal behavior for your particular child and what that looks like. So when you start to observe those behaviors or moods that are kind of outside of the norm for your child, especially for a prolonged period of time, this can be an indicator for you to step in or intervene. So now I want to touch on suicidality and self-harm. And non-suicidal self-injury is also known as self-harm. So again, you might hear those terms used interchangeably. Self-harm is the act of purposefully causing harm to your body through the act of burning, cutting, or picking. Some more obvious engagements in self-harm that you would be likely to already be privy to would be headbanging, hitting themselves, slapping themselves, or body slamming. Those are going to be more obvious behaviors as opposed to the burning, cutting, or picking, which are easier to hide. And self-harm is simply a sign of emotional distress, right? There are a lot of biological factors to prove why people engage in self-harm and what it does for them on a physical level. It's giving them that instant relief from that intense emotional distress, and they do not already have alternative coping skills in place, or maybe they're willful around engaging in coping skills. So maybe this is something that you are familiar with your teen, and they have those coping skills at their fingertips, but because they don't get that immediate relief that they get from engaging in self-harm, they find themselves less likely to engage in those coping skills. So it's important to continuously reinforce, as you are made aware of their engagement in self-harm, for them, their alternative coping skills. And self-harm behaviors usually begin around ages 12 to 14. And it's more common in teens and young adults than it is in young children. And it can start young when they have big feelings and they're really unsure of how to deal with those big emotions. Maybe they're dealing with some shame surrounding those big emotions, and they feel as though it's not appropriate to express them, or that they don't have a safe adult to talk about those big feelings with. And so their rely or their fallback is going to be engaged, or could potentially be engaging in self-harm. Self-harm does not necessarily mean that your child will make attempts or is interested in possibly attempting suicide, right? But it can be a warning sign. So it's a red flag. It's something that we want to look out for. And we'll talk more about suicide and self-harm in our next parent series, which will be launched in November. Statistics around self-harm are often skewed because teens and adolescents, unfortunately, are sometimes just poor reporters, right? But it's estimated that anywhere from 1/3 to 1/2 of adolescents in the US have engaged in a form of self-harm, according to a poll that was conducted by Mental Health America. And again, just to reinforce, self-harm or the engagement of self-harm does not always mean that your child is experiencing suicidal thoughts. But again, it is a cry for help. When self-harm is left unacknowledged or untreated, it can lead to engagement in riskier behaviors, right? Such as increased frequency. Maybe they're going to start engaging in self-harm more often. Or maybe they're going to start using more lethal forms of self-harm. Maybe before it was just picking, but now they're using tools. And so that's why it's important to address those issues as soon as you're made aware of them. Oftentimes, the concerns of a parent are centered around, should I have this conversation with my child? If I say something, am I going to put the idea in their head? And the fact of the matter is this: if you're already noticing this behavior, those thoughts are already there. You're not protecting your child from something by having an honest conversation with them about it. It's important that you, as the parent, when you're made aware of this, that you remain calm, that you seek help, and that you educate yourself on self-harm. Recognize that it's not personal, right? It's not about you. It's not about how this is affecting you. It's about what's going on with your child. And you can work with your child on identifying appropriate alternative coping skills. There might be a lag time between when you're made aware of the self-harm engagement and when you're able to get your child to a mental health provider or your pediatrician, right? So it's important as soon as you're made aware to engage in that honest conversation and identify appropriate coping skills for them. Maybe that's engaging in some self-soothing tools like Daniela talked about earlier on in the presentation, listening to music, watching TV, listening to, a comedy show, whatever that looks like for your child, and not putting barriers in place for your child to engage in those alternative coping skills so that it feels very seamless, right? Because what we're wanting to do is we're wanting to decrease the likelihood that they'll continue to engage in the self-harming behaviors, and that if they do engage in them, maybe they will use less lethal methods. When do I want to seek help and suicidal ideation warning signs? If you start to notice that your child is avoiding their friends or social activities, maybe they have observed changes in their sleeping habits, they're feeling tired or low energy, changes in eating habits, again, usually increased hunger as opposed to lack of appetite, but sometimes you might notice a lack of appetite as well. If they're engaging in risky behaviors, and this to me is one of the bigger red flags, as we know, engagement in substance use experimentation is very normal for teenagers. But if we notice that it's happening more often or they're being riskier with those behaviors, that's going to be a really big red flag for us, because that usually indicates they are engaging in these behaviors to help them cope through those big emotions. Sometimes, again, they might verbalize those thoughts and feelings of suicide. And maybe it's not so bold as to say, I'm thinking I'm going to kill myself. I've thought about it. That's what I'm going to do. But maybe it's general language like, if I wasn't here anymore, how would you react? What would that feel like for you? Or if I didn't wake up tomorrow, it really wouldn't be that big of a deal. So it doesn't have to be an outright statement of, I want to commit suicide. It can be that there are other things happening around in that conversation, or their inability to carry out daily activities or handle daily problems and stress. Maybe you have a child that is really great helping out at home. They're completely consistent when it comes to, well, as completely consistent as a teenager can be, but they're very consistent when it comes to emptying the dishwasher, feeding the dog. And all of a sudden you notice that maybe they're just not interested, or they're verbalizing, I'm just too tired to do it. I don't feel like I have the energy. Or maybe your child was doing really well about handling those daily problems and stressors surrounding school or conflict with friends. And then you notice that they're now having big emotions around those experiences. Those might be some red flags for us. There are some things that you as a parent can do to help. We want to have open and honest conversations about mental health. We want to do emotional check-ins, have frequent conversations about it, just as you would about your physical health, right? Get feedback from others, seek professional help, and also learn how to regulate your own emotions and stay calm. When we have these conversations with our kids, we want to make sure that we're validating their experiences. And validation is not the same as agreement. Validating is saying, I can understand how you feel that way. I would feel similarly. Just because your child is feeling a certain way doesn't mean you yourself have personal experiences with anxiety or depression. And that's okay. It doesn't mean that you have to understand it. It's just important for us to validate it so that your child feels like they're being seen and they're being heard, so that they're more likely to continue to come to you whenever they're feeling those big emotions or when they're having a hard time processing what's going on around them. So again, reaffirming validation is not agreement, and it's okay if you don't understand it, if you don't have a personal experience, and you can still work with your child on this and be a support system for them. Having an open dialogue about how they're doing mentally will make it easier for them to disclose when they're struggling when they disclose when they are struggling themselves. So maybe you guys have sit down dinner, maybe you have weekly family meetings, or maybe you guys ride together in the car in the morning or afternoon to and from school. These are great times to talk about maybe what you yourself are struggling with in an appropriate way. And then the more often that they hear you talk about your own struggles, the more likely that they are to feel comfortable talking about their own. You might want to check in with others who have frequent contact with your child, whether it's counselors, teachers, family members, friends, maybe parents of your children's friends. Maybe they're noticing symptoms in your child, or maybe they have some cause for concern and they don't know how to approach you about it. Sometimes it's easier if you go to them and say, hey, like, I'm noticing that my kid is really struggling with X, Y, and Z. Do you see this yourself? What are you seeing from them? And working kind of collaboratively, because ultimately we're all working together to provide safety and openness and honesty and help for your child, right? We want to include the whole family. Transparency is what's going to help prevent those feelings of guilt and shame that often surround having depressive feelings or having anxious feelings. And ultimately, you want to make sure that you're getting a professional opinion. Always start with your pediatrician or your primary care physician. Clue them in, because again, the more hands that you have on deck, the easier it is to be on the same page, the easier it is to get them the help that they need. And of course, you can always reach out to your school counselor and social worker to clue them in as well and get them get your child some additional support on campus. Never forget that it's always important for you to seek care in an emergency or a crisis situation. So if your child has engaged in some really risky self-harming, if they've made an attempt, or if you have really severe safety concerns, do not hesitate to take your child to a pediatric facility like Dell Children's, which is local here in the Austin area, or you can also call 988, which is a mental health hotline. Here we have some reading materials available for you. One of my personal favorites is Parenting Teens with Difficult Emotions. It kind of just helps you to have some additional foundational work on how to work with your teens whenever they're going through those big life changes. They seem really dysregulated, they seem really irritated, and it can kind of help walk you through some alternatives to you being, overly emotional yourself and how to handle those. Also, Brainstorm, The Power and Purpose of the Teenage Brain, The Whole Brain Child, No Drama Discipline, and How to Talk So Kids Will Listen and Listen So Kids Will Talk. If you have any questions, please feel free to reach out to any of the mental health providers listed in this presentation, whether it's the school social workers or school counselors. Please know that we are all here to support you, your family, and your children.